Yeah, and it needs a solution,
Yeah,
right?
yeah.
Well,
We said we gotta do something.
yeah,
I
and
told him I'd check with you for a valve job.
sure. I tell people this all the time. This is plumbing, and I'm a glorified plumber. Okay, that's all this is plumbing. Okay, you've got a valve that's not working properly. It's not opening completely, so your heart's having to work overtime to push the blood through that valve.
Right.
Well, your heart is like your arm muscle. If you did arm curls all day long, you'd get a really big, thick muscle. That's not so good when it's the heart, because that can lead to heart failure or even a heart attack if the muscle gets too big for its own blood supply.
Right.
Then in addition, you've got, it looks like just one of your heart blood vessels, coronaries, is blocked fairly tightly.
Okay.
So that looks like that looks like it needs a bypass too, based on what I'm seeing on the films. So basically, based on what I'm seeing, you need to have that aortic valve replaced, and you need to have what looks like a single vessel bypass.
Okay.
Now, I always say what it looks like, because until I get in there, I never say for sure. Just like if someone, we think they need 4 bypasses, I get in there and they end up getting 5 or 3.
Working on a car.
Right, you don't know until you get in there.
Hey, I'm in for an overhaul.
Yeah, okay, yeah, pretty much. Now, do you have any other medical problems, kidneys, lungs?
Diabetes.
The diabetes, and you're on Januvia for that?
Yeah.
How's your sugars been running? How are they been running for you?
Been running pretty good. It's right around 100, I would guess.
Really?
I had a little trouble with the while doctor took. I was on metformin, and he just pulled that, and that cut me down a lot. I was taking 1 pill a day.
Oh, really?
And that didn't work so well. But
so what now?
well, my A1C went up to 178, but now he's got me on that Januvia, and still on the triglyceride.
Glyburide?
Glyburide.
Okay.
So between them, I think we're doing a lot better.
And your A1C is what? Like 1 point?
It was 7.8.
Okay, I thought you said 1 point. I was like, well, congratulations.
Yeah.
Oh, 1 point. Yeah. Okay. Good.
It's been pretty well under control.
Okay.
And I don't have any trouble with it. When you get sick, of course, it goes up further, but I haven't
Right,
had any
right.
problems.
How old are you now?
80.
You're 80. Yeah, that's right. Yeah, you're the guy who's 80 but looks 70. Sort of what I heard about you.
I would like to look 70. Some will think 90, but they slow that down because it's speeding.
Yeah. Now, where do you live?
In Iowa.
In Iowa. Okay. All right. So you're about 20 minutes away from here, right? Do you live with family, or you live by yourself?
I live with my wife.
What?
She's 95 and I take care of her.
Oh, really? So she was robbing the cradle.
Yeah, she's on a go-kart.
Oh, yeah.
And
Yeah.
so matter of fact, I told her several times, if she ever dies, I'll make somebody a good housewife.
That's pretty good. That's pretty good. Let me see here now. So how bad have your symptoms been lately, you think, as far as any shortness of breath or chest pressure? I heard you're having shortness of breath when you exert. Is that
Yeah,
right?
I can't exert very long. I can't even walk around too long. I go grocery shopping, of course, Walmart and Sam. Sometimes at Walmart I'm pushing, I don't.
Right.
I'm tired.
You're tired. And what about going up a flight of stairs?
Oh, well, as long as it's no higher than this bed, I'm okay.
Oh, really? But you can't go up one whole flight of stairs.
Oh, well, I won't say I haven't had the opportunity.
Yeah.
But I wouldn't try.
You wouldn't try.
I don't really wish I had to.
Why? What happens? You get short of breath, you get chest pain.
I can't breathe.
You can't breathe. How long has it been bad like that, you think?
I don't know.
Unless it was getting worse, you know. Lately.
I had a atrial fibrillation. That's when I found out I had a bad valve.
Yeah.
And that was 4 years ago. I have been getting, that wasn't so bad,
Right.
but I've been getting progressively worse.
Okay.
And the reason the doctor noticed it last time I went to the doctor's office, I got winded going from the waiting room to the doctor.
Right, right, yeah. So, do you think it's been at Christmas time? How were you compared to now? Are you getting at Christmas time? Were you doing okay, or were you having problems?
No, I had slowed down a little bit,
Okay.
like I am now. It's hard for me to tell because at my age, you don't know whether it's your heart or old age.
Or old age.
I told my wife, I'm getting so lazy, I'm getting ashamed myself.
And let me tell you though, what we found more and more is not that it's not your old age. It is, especially with this aortic valve problem. It is the valve that's giving you the trouble. I mean that's why you're slowing down. And especially when you start doing TAVRs, these 90-year-olds in one day, it's amazing. You're not on Coumadin, is that right?
No,
Okay.
I'm on Pradaxa.
You're on Pradaxa. Okay, well that.
Been on it for about 4 years. I'm ready to get off it.
And you're still in atrial fibrillation.
No, I went in atrial fibrillation and they took me and shocked me out of it.
Okay.
And I took some heart medicine and I went for about, I guess 2-3 years. I went into atrial fibrillation again.
Okay.
And it shocked me out of it
Again.
again. And
And now,
I'm taking heart medicine, but I haven't went back into that.
so he's in the sinus as far as you know. So and did you take Pradaxa today?
Oh, no.
Friday.
Friday.
So Friday the 15th.
Friday morning.
Okay, good. Okay. Well, what kind of questions do you have then?
I guess from what you said, you'll do an open heart.
Yes, sir.
Chest open. How soon will I be able to drive after that? How soon will I be able to drive after today?
Here's the thing, after surgery, typically, I like patients to wait 4 weeks before they get behind the wheel.
Oh,
Yeah, because
that's a lifetime.
that's a lifetime, that's right. Well, let me tell you why. Your reaction times are gonna be a little fuzzy, a little slow,
Right.
because of the anesthetic, because of the surgery, because of the pain medicine, because of all that. The last thing we want you to do is hit the brakes too late, and run into somebody or something. And it takes about 4 weeks till people.
I've got one of those weird cars that hits the brakes for me.
Oh, really?
I
Oh,
don't get off.
we should all have that, right?
Huh?
We should all have one of those.
Well, I guess so. I don't, sometimes it irritates me because I'm an athlete. I watch cars, man, I put
Sure.
myself in. It's not close to me, but my car thinks it's close.
Smart car.
Yeah, it's too smart for me. My computer.
Well, now, I'm just thinking out loud here. Would it benefit you to come into the office after you've had a little time to talk to your family and visit me in the office sometime in the next few days so that you can get your questions lined up? We can talk in more detail about surgery and then schedule you for surgery. Would that?
Okay. Well, now let me tell you where
Yeah.
I'm at.
Mhm.
Of course, I told you I took care of my wife. I called my daughter and she said, hey, she'll be here. All she needs is 1 day notice.
Okay.
And so I called her to take over taking care of my wife. I was told that I would be in the hospital 4 or 5 days.
Correct.
Is that about right?
I say 5 to 7, just
5 to
after
7.
surgery. Yeah.
Okay. And I was told I wouldn't do any straining for 6 weeks.
6 weeks. That's right.
Is that about right?
That's about right. Yeah.
Okay. Well, I've got all my preparations made because he told me that when I went to the office about when, and I told him.
Okay.
So,
So you're saying you don't need to come and see me in the office, or?
well, I can or not. I pretty well understand.
You pretty
my
much understand, so
situation.
why make another trip in here if you've got your questions answered, is what
Well,
you're
my
saying?
questions are pretty well
Yeah.
answered yet.
Again, your chance of surviving this thing, I'm gonna say about 95%, 95 out of 100, give or take, let's say that. There's about a 1 in 20 chance you wouldn't make it through this operation or in the post-op period. There's always risk of complications, bleeding, infection, stroke, heart attack, kidney failure, lung failure, intestinal problems. Those are relatively rare. Diabetics tend to have a few more complications, but it's usually the bad diabetics. It doesn't sound like your diabetes has been that bad. But I always warn people about that, especially as they get a little older and on an age, your chance of things like stroke are a little bit higher, 2 or 3%.
I don't like the alternative.
Right, well, yeah, exactly. And the alternative, honestly, we've known this for a long time. If you have aortic stenosis, like you have, and you can go along for years and not really have any problems. The minute you start developing symptoms, we know that from the time you have onset of the symptoms, your chance of being dead in 2 years, if nothing's done, is 50-50. Now, breast cancer, colon cancer, lung cancer, prostate cancer have a better 2-year survival than this aortic stenosis, which is why people sometimes will hem and haw about having their aortic valve replaced at age 85, but you throw it at them and say, well, if this is a lung cancer, would you want us to cut it out? And most people would say, yeah, so yeah, that's real world numbers there. So I think it's the right thing to do is to have the operation, even though there's a small chance, 1 in 20, that you wouldn't survive the operation. The flip side is that if you survive, your life is going to be improved. You're going to be,
Well,
you're not going to be short of breath and that sort of stuff.
I'd rather have the operation. What was it? Dick Cheney, the old vice
Yeah,
president,
right.
had a heart transplant.
He had a heart transplant.
And he
That's
said
right.
he couldn't hardly walk across the room
Right.
before, and afterwards he could throw big 40, 50-pound sacks.
That's
around.
right.
And I'm always hoping that'll be the good part that I can do.
And that's what we hope for you too. That's what we hope for you too.
I'm good. I think you've answered already, between you and Dr. Young.
Dr. Young.
I know the situation. If I had to be ready, I could be ready by Friday or any time after that.
Tell you what, you're gonna go. He's going home today, right?
I think he's gonna kind of see what you
Yeah,
said.
yeah. You can go home today.
Okay.
I want to look at my schedule. We'll call you back by tomorrow. Okay, we'll give you a surgery date, or at least a couple of days choices that because there may be one day or the other that ends up working. Once you go home and talk it over with the family, you never know. So, but it'd probably be sometime early next week that we would do surgery. Today's Tuesday.
Oh, well, that would work fine. I'd call my daughter.
Okay.
She'd get up here.
Get up
That
there.
was the only thing that held me back. She lives in Kansas City, Missouri.
Yeah,
It
yeah.
takes a while to get down here.
Why don't we go ahead and give you a call tomorrow after I've had a chance to look at our schedule, and we'll let you know, a day or to give you a couple of choices and see what works.
Okay.
To talk to you about. Is that okay?
That sounds great.
That'll take care of him, because he was worried right now.
Yeah,
But
right.
he's scheduled,
Mm-hmm.
and we're trying to get things lined up for
Yeah.
my mother.
Oh, I understand. I totally
But that
get
really
that.
took a lot of pressure off of him,
Yeah.
and not going in today.
Right.
Staying
Yeah.
over there.
Yeah.
That'll
Absolutely.
give him time to do what he needs to do, and
Yep.
us schedule all our help.
Sure. Okay.
How soon can I start driving after today, after procedure?
Ask
think
Dr.
your
Young
key's
that.
got a
What
lock.
does he
I'll
usually
go
say?
over that with you before we go home.
Okay.
24 hours is usually what we say though, okay?
Okay, that's just what I want an idea. I still gotta stock up on groceries and shit.
Ah, sick.
Maybe, Jim, I need to borrow